Hello friends. Everyone aware of the word diabetes mellitus. In simple or general language, diabetes means increase in blood glucose value. But if we see the scientific definition of diabetes, it is increase in blood glucose due to abnormality in carbohydrate metabolism, which may lead to further abnormality of other biomolecule like lipid, protein, amino acid, etc., which may also lead to damage to tissue or complete organs, especially the kidney as well as heart. Hello, let's see about this diabetes today. We'll just discuss which are different types of diabetes mellitus. Diabetes, it is a group of metabolic disease in which there are high blood glucose sugar or high blood sugar is observed. See this diagram here, the white beads like appearance, it is a sugar molecule. Other are RBC, WBC and whatever thing which is observed inside blood vessels. So if we compare this blood vessel with this one, can you see the difference? Here you will find there are many number of dots, white color beads. They are nothing but sugar. So this is the difference between the normal person blood vessel and diabetic person blood vessel. In normal person you will find less glucose, normal which is in the range of 70 to 110 milligram per TL. While if the person is suffering from diabetes mellitus, you will find the blood glucose is going to get increase. Let's see the type. The diabetes, they are majorly of three different types. That is the type 1 diabetes, type 2 diabetes and gestational diabetes. This diabetes, it is the major cause due to there is a problem in the pancreas. That if pancreas is not able to produce enough amount of insulin, or if the insulin is produced in normal amount but the cell are not going to respond this insulin, or we can say the cells are resisting this insulin. Insulin, everyone know it is nothing, it is a hormone which is very important to regulate blood glucose value by decreasing the blood glucose value. This is type 1 diabetes. Here we can find this is the area from where the different hormones are secreted. This is a section of pancreas. From this, the pancreas, the section it shows, this is the area, it is the islet of Langerhans. In this islet of Langerhans, different type of cells which are observed, that is beta cell, alpha cell, delta cell. The beta cell, they are responsible for synthesis of insulin, while alpha cell, they are important for synthesis of glucagon. Insulin, it decrease blood glucose value, while glucagon, it increase blood glucose value. So in case of type 1 diabetes, there is a failure of pancreas to produce enough amount of enough amount of insulin. So if insulin is decreased, then blood glucose value is increased. This type 1 diabetes, it is also known as insulin dependent diabetes mellitus, or in short it is IDDM, or it is also known as a juvenile diabetes. Insulin dependent diabetes, why? Because here the insulin secretion is less. Normal insulin, it maintain blood glucose normally, but if the less insulin are there, then blood glucose value gets increased. It is also known as juvenile type of diabetes because this type of diabetes, it is mostly observed in juvenile. Juvenile means the age of children which is less than 15 years. So this type of diabetes, it is mostly observed in the children of age less than 15 years. Type 2 diabetes, it is the type of diabetes in which insulin is produced in required amount by the pancreas, but the cells are not responding to insulin. That's why though there is a required amount of insulin, the cells are not responding, so blood glucose value is not increase in the blood. So this type of diabetes, it is known as a non-insulin dependent diabetes mellitus. Why? Because here the insulin is in required amount, but the cells in which insulin showing its function, it is resisting or not responding to insulin. It is also known as adult onset or maturity onset diabetes because this is mostly observed in the person of age more than 40 years. The main cause is this leads to excessive body weight loss, and if the person is not going to do exercise. Last type of diabetes, it is a gestational diabetes. It is the third main type of diabetes. It is mostly observed in the pregnant woman without any history of diabetes. That means the lady who is a pregnant, in that you will not find diabetes previously, but due to pregnancy, due to some changes going on inside the body, that lady may suffer from diabetes. That is known as a gestational type of diabetes. So this is all about the type of diabetes in brief. Thank you.